study aims to address the potential use of spray-dried bovine serum gamma-globulin in first colostrum replacement feeding in the aim to reduce transmission of Mycobacterium avium vibrio paratuberculosis from dam to calf in dairy herds. The study consisted of an experimental group of 10 calves, fed 2 liters of milk and 300 grams of spray-dried preparation containing 79.5 grams of gamma-globulin fed in the first 2 hours of life, compared to a control group of 10 calves fed colostrum. Blood samples were taken before colostrum feeding, at 24 and 48 hours after colostrum feeding, and again at 7, 14, and 21 days. Clinical exams were performed to evaluate calf health over the first month of the life. If we look at the results, the graphs in the center, the gamma globulin was higher in the control group in comparison to the experimental group at the 48th hour of life. However, the albumin, we can see serum albumin concentration was higher in experimental calves in comparison to the control calves, probably due to its higher absorption and higher concentration in blood serum preparation. The total serum protein was also higher in the experimental group than the control group, and we can say that this is also due to the higher albumin concentration in this group. Fibrinogen and haptoglobin, we can see some differences between the experimental and the control group. In general, if we look closer at the data, this is due to some single outliers. So we can say that no significant differences are seen between both groups over the first month of life. The apparent efficiency of absorption was 21.2% for the spray-dried plasma, which we found satisfactory, especially considering the fact that we have only 79.5 grams of gamma-globulin in this preparation. In conclusion, we can say, according to health data, haptoglobin, fibrinogen, and immunoglobulin results, that across the first 3 weeks of life, they did not differ significantly between experimental and control groups. And according to this, that we can encourage further optimization of this method for the potential protection of calves against Mycobacterium avium on dairy farms.